All right, so thank you for joining today's CCBHC Implementation Science Pilot Learning Collaborative. It is our second and final session for this learning collaborative. And next slide, Amanda. All right, here's just our typical housekeeping logistics slide for those of you who need a little reminder. If you have any questions, you can use the Q&A box. And then if comments, you can put into the chat box. And then we have a live transcript function so that if you need to see subtitles, you can click there and activate the live transcript as well. And like Matt said in the chat, today's session is being recorded just so that you all know. If you have any questions about that, feel free to message one of us and we can talk about that offline a little bit. Next slide, please. Here's our funding disclaimer. I won't read through it, but it's just here for y'all to see. Next slide. Alrighty, so here are some of our wonderfully esteemed partners that have worked with us on this learning collaborative and throughout this past year. You'll have an opportunity to hear from UConn in a little bit, MPHI, but right now what I wanted to do is hand it off to SAMHSA to say a few words. Nima, you heard from her at our last session, but she has joined us again today. So you'll have an opportunity to hear a couple words from her. So Nima, I'll hand it off to you.
Thanks so much, Flannery. It's so exciting to be here with you all again. Again, want to thank all of the participants in this pilot that have been really working hard towards this project. We're really excited about this work. I'm really excited about the work that you've put in and that you're here in this learning collaborative. Just really want to reiterate the value of this project, right, and trying to create new kind of practice-oriented research with the focus on implementation science. And we think there's such value in this. Want to also reiterate our interagency commitment to this project between the National Institute of Mental Health and the National Institute of Drug Abuse. And we have our points of contact from both of those places today. So we're really excited about that. So yeah, just want to thank everyone, and I'm going to hand it off to Dr. Mike Freed and Dr. Sherazad Mandavi. Thanks so much.
Hi, good afternoon, everybody. Let me just do a quick screen share on some slides. My name is Mike Freed. I'm the Chief of the Services Research and Clinical Epidemiology Branch at NIMH. I'm joined by my colleague, Dr. Sherazad Mavandati, as well as Dr. Sean Lynch from the National Institute on Drug Abuse. And just to really highlight how much we've really valued this collaboration, a couple of years ago, SAMHSA and NIMH and NIDA put together a notice of special interest. And this is really NIH's way of highlighting really important research priorities. And you see that at the top bullet here about using implementation science for delivery of evidence-based practices. And then recently we issued a NOFO, a Notice of Funding Opportunity announcement. And this is really about advancing learning healthcare research in outpatient mental health and treatment settings. Both these announcements call for implementation science and services research and really require active collaborations with CCBHCs, because we know that this is, or with practice partners, including CCBHCs, because this is such an important component of conducting research. Recently, we actually funded 3 projects that I can just mention here and talk a little bit more during the breakouts. That really involve active partnerships with CCBHCs. So the first is titled "A Service User Informed Study of CCBHC Implementation and Impact in New York State." This grant goes to Dr. Josh Breslow and Neb Jones. It's a mixed method study, and it's looking at service user perceptions of CCBHCs and the impacts of CCBHCs on acute care utilization and quality of care. The project also seeks to evaluate how different payment methods affect these outcomes. What's really important about this project too is that service users are actively engaged in all aspects of their research. The second example is a clinical trial testing a peer-led intervention for depression among people with depression and substance use disorder in CCBHCs. This goes to Drs. Julia Fenton and Jessica Madison. And here the investigators are partnering with the CCBHC in Detroit, Michigan. And then the third project is really about developing patient-centered quality measures. Here, the investigators, Josh Breslow and Carolyn Blaum, are working with CCBHCs to develop we call outcome-focused quality measures to look, for goal-directed care. And this is for individuals with serious mental illness. And the investigators have really partnered with 7 CCBHCs to provide data necessary to develop these outcome-focused quality measures. So with that, I'll stop and just thank everybody. Thank our host for inviting us, and also really thank you for attending. And let me stop sharing the screen here.
Thank you, Dr. Freed. And I think, hold on, I think we have a couple slides, Amanda, if you are able to throw them up before we get started. That kind of highlights the structure of this afternoon. Next slide. Great. So we're going to be doing 2 rounds of breakout rooms for this afternoon at 30 minutes each. And I'm going to hand it off to Michelle to provide a little bit more context as to the different topics and how the different breakout rooms will be structured.
Great, thank you. This will be really brief. I guess I should start by always thanking you for giving us your time and attention on this important project. So thanks for showing up today. And I hope everybody had a great holiday weekend. So these breakout rooms come in direct response to both the convened meeting that you had with SAMHSA months ago now, and then the feedback we received from the meeting that was just held a couple weeks ago in August, both in the evaluation, but also comments that were made in the breakout rooms and suggestions to us about information that still would be helpful and important to help you move ahead in this project. So the first round, as Flannery said, is 30 minutes. And Matt, our excellent tech host, will fly you in and out of that session. So don't think you're getting extra time. So please watch the time. The 2 breakout rooms that we're focused on at the beginning are NIH funding. You'll get your panel of NIH folks, including NIDA, inclusive of that, to talk about any application ideas, questions you have. If you've submitted and you have questions, I'm sure they'll either talk to you then or schedule a time to talk to you afterwards, but all focused on NIH funding. And then the second breakout room option is a diverse funding source option, and that'll be housed by me, led by me, and we'll talk about some of the places you can look to either submit applications to, and that's where you want to land and stay, or in preparation so that you're readying yourselves to be better prepared for an NIH application. So Matt will throw into the chat, I think, or somewhere you'll have the opportunity to pick which room you're going to go to, and that's how you'll get there. And then you'll just come back to this main room at the end of that 30 minutes. And the second breakout group options that you have are led by Angela Weeks, a session on building strong partnerships between CCBHCs and researchers. And then we heard you really clearly that one of the things that you appreciated was the opportunity to actually have peer-to-peer conversations. So you have an option to join an unfacilitated peer-to-peer conversation with smaller CCBHCs or picking larger CCBHCs. And again, that feedback and that kind of clustering came from feedback that you guys gave us as well. So I hope these sessions are impactful. Obviously, anytime you go into a breakout room, you make it what you need it to be. So please engage and talk and ask questions. And Matt, I think we're ready to fly people where they need to go. So
okay, so how it's going to work is I'm going to open up the breakout rooms right now. And hopefully it automatically brought up a breakout rooms window for you all. If it did not, then please look along your Zoom bar and you should see a breakout rooms icon. And then you will be able to choose whether you want to join the NIH funding room or the diverse funding sources room. There should be a blue button at the end of the bar that says join. I see people joining already, so that's great that it's working for folks. If that's not working, we can come off mute one by one and let me know where you want to be, or you could put it in the chat, but you should be able to join those rooms. Just want to let you all know that we're going to have a 30-minute timer on these rooms. So after 30 minutes, maybe at around 25 minutes, I'm going to send a message that we'll be wrapping up, and I'll bring you all back in about 30 minutes.
So welcome back. And now you get to, I hope that was helpful to people. I hope you got to speak if you wanted to and got to hear what other people were thinking. So we're going to do it again. And now what you have are two options for unfacilitated breakouts. So there was a specific request to just get a chance to talk with each other. So Matt's going to put that up again. You're going to pick. We went ahead and did small versus large CCBHCs just simply because the large of you seem to have more internal resources for your own internal researchers or evaluators, just a different level of capacity. And that, I think, it needs to be acknowledged in how you're going to go about successfully responding to this opportunity. So the other breakout room is building strong partnerships with Angela Weeks. So go ahead and pick your spot, and we'll see you when you get back.
All right, those rooms are open now, just like before. You should be able to join whichever room you'd like. You may need to open up the window with the breakout rooms icon down on your Zoom bar. And if anyone needs help moving to the room that they have to get to, please just let me know. I'm going to set a timer for 30 minutes, just like before. Okay, welcome back, everyone. I believe that is everyone.
Thank you, Matt. And I think it's on me to close out today's learning collaborative. All right, thank you, Amanda. So thank you everyone for participating in our breakout sessions today. And thank you for our facilitators who joined and really led those sessions. Michelle, Angela, I don't think we have Dr. Fleet on anymore, but thank you everyone who joined us and helped facilitate those discussions. Here are just a few kind of next steps or really just considerations for you all to keep in mind post-learning collaborative as we are wrapping up our current base year funding on this initiative and really identifying what our next steps in terms of technical assistance support for you all will be in this upcoming project year. With that in mind, you know, we're still offering individualized one-on-one technical assistance with UConn. So when I get to the next slide, you'll see Camille's email address there as a reminder in terms of like, if you think of any technical assistance needs to reach out to her and she'll help coordinate that with UConn. But for some other things, just to keep the momentum going and the work that you all are doing is to continue to speak to staff and partners regularly about the goals of the CCBHC to help solidify a common language and understanding of vision, develop communication plans that include your strategy for maintaining consistent communication with research partners, CCBHC staff and community partners, connect with peers at the same stage of implementation, and we'll have a follow-up survey that we'll send out probably next week for those of you who are interested in connecting, that we can collect some of those email addresses and topics. Continue to refine and define implementation science projects, so just continue what you're all doing. Consider areas where technical assistance would be beneficial to build capacity and implement evidence-based practices. So that's, you know, where if you have TA requests for UConn, you know, reach out to us and let us know and we can get you connected. Next slide. All right, so kind of a brief closing and reminders. There will be a brief poll at the end of the session and then a post-session survey to complete. So two things. Both of them are anonymous. And to request an update to your organization's information as it appears in the database, contact Camille. She will make sure that is updated. Also, if you have any new or updated pilot partner project templates, also get that to Camille. And then finally, like I was saying, one-on-one consultations, they're free. So let us know if you're interested, or let Camille know. She's on top of everything for the inbox, and we'll get you connected to UConn there. So I think with that, that's probably our last slide. Yep, here we go, is the poll.
Okay, so that Zoom poll should be launched. If you're able to, please fill out our Zoom poll to let us know how we did today. Again, it is anonymous. And then once we close this session, you should be automatically prompted with a browser window that includes a more detailed survey for you to fill out. And again, that's anonymous as well. We really appreciate your feedback.
Thank you, Matt. And thank you everyone again for joining us.